So students, in last session we have been seen about till the malt. Okay, so now we'll be seeing about the overview of the immune system. Okay, in classification in immune system we have been seen about the innate and then even adaptive we have been seen. Okay, so now we'll be seeing about the components of it. Okay, under the innate and then adaptive you are seeing students, there are two types of component. Okay, there is a cellular components and then humoral components. Okay, so these two components are there. So first what are the cellular components? Okay, so first I am discussing about the innate immunity. Okay, so under the cellular components, what are the components will be included means that is for example there's a phagocytic cells. Under the phagocytic cells, it will be includes monocytes, macrophages, and neutrophils. Okay, so this will become under the phagocytic cells. And then even in cellular component, it includes the natural killer, mast cells, and antigen presenting cells. Okay, so these are the cellular components. And the next will be the humoral components. So humoral components under the innate, what are the components becoming? There is a complement, acute phase reactants, and then cytokines. So this all will become under this humoral components. And then adaptive. Next we'll be going for adaptive. So in adaptive, the first cellular components. So in that, what are the components becoming? There is a T lymphocytes. T lymphocytes and then B lymphocytes. There is a T cells and then B cells. Under the T cells, there are four type of cells becoming. There is a helper T, killer T, memory T, and then suppressor T cells. So this all will become under this T lymphocytes. And the next B lymphocytes. Okay, that's all will come under the cellular components of the under the adaptive immunity. And the next is the humoral component. So in humoral component under the adaptive, it will become immunoglobulins. Immunoglobulins will become under this humoral components. Okay, so these are the different components will become under this innate and then adaptive immunity. Okay, so next we'll be going to see about the defenses here. The first line defense and then second line defense. Okay, in first line defense students you are seeing, okay, so there is a barriers also we can say. Okay, it should be prevent the microorganisms or bacteria or harmful substances. Okay, so you can see here the skin and then ciliated cells, lysosomes, coughing, vomiting. So through that harmful substance will be come out. And the next is second line defenses. Okay, so in second line defenses, students, here some cells, okay, group of cells or tissues and then even organs. Okay, so it will be protect the body. Okay, for example, you can say take your blood clot, then mast cell, cytokines, leukocytes. Okay, so these are the second line defense. So next we are going to say about the cells of the immune system. Okay, so students, with this, I mean, just you are going to see structures only here. You are seeing the name and the diagram of it. But even I'll be explaining about the functions of each one. If you have any doubts or if you didn't understand of it, means please ask me, students. Okay, because in this PPT, I didn't present the functions of each of them. Okay, I'll explain the functions of it also. Okay. Okay, so in cells of immune system, so the first you can the stem cells. So stem cells divide into lymphoid stem cells and then myeloid progenitor. Okay, the lymphocytes will produce the lymphocytes and then myeloid progenitor will give the granulocytes. Okay, so under the lymphocytes you can see there are the three divisions here. Three cells, there is a B cell, T cell and then natural killer cell. So first we'll be seeing about the B cells. Janvi, so please don't scribble on it on the screen. Okay, so B cell. Okay, so this B cell, students, it will be helpful to make the antibodies against the antigen. And then even this B cell will develop the two types of cells. You can see here there is a plasma cell and then memory cell. And the next is about the T cell. So T cells, students, what will do means it will directly kill the infected host cells. And then even it will produce these cytokines also. And then here you can see there is a TH cell and then T cells will become under the T cell. Okay, it is divided into TH and then T cells. Both are our T cells only. Okay, so this TH cells what will do means it will be increase the expression level of the MHC1 and then MHC2. Okay, and then even the T cells will be a stimulate. Okay, to stimulate the B cells to make the antibodies and then help to kill the cells. And then even you are saying first about the plasma and then memory cell. Okay, I didn't explain about it. So this plasma cell. So the plasma cell what will do means it develop, it make the antibodies to fight against the bacteria and then virus to stop the infection and then disease. So that is the function of the plasma cell which is come as the B cell. And then memory cell. So memory cell what will do means it will be remember. Okay, it will remember the same pathogen. Okay, if it is pathogen or microorganism has entered the body, remember the antigen and then it produces the antibodies faster than infection. Okay, that's the function of this memory cell. And the next is natural killer cell. So natural killer cell, students, here what will do is it controls. Okay, it controls the, several types of the tumors and then microbial infection also. So it's the function of the cells, okay, the B cells, T cells, and the natural killer cell. So next we are going to see about the granulocytes. So in granulocytes, first will be about the neutrophil. So neutrophils, they are also called as in phagocytes. So here this neutrophils, what will do means it will be ingest the bacteria and then even other foreign bodies also. Okay, it will be ingested. And then after entering the bacterial foreign bodies into that, this neutrophil, okay, the granules will be there. Okay, so that will release one enzyme. So this neutrophils will be contains the granules. So the granules will be release the enzyme which help to kill and then digest the bacteria and then even foreign cells also. Okay, that is the function of this neutrophil. And the next is about the eosinophil, okay, eosinophil. So this will be help, okay, for trapping the substance, killing the cells, and then even it be having a anti-parasitic activity and bacterial activity, antibacterial activity. And then basophil, so this basophil what will do means it prevent the blood clotting. So it prevents the blood clotting because it contains the heparin. Okay, heparin you know so as the anticoagulant agents. Okay, it will be contain basophil will contain the heparin. So that's why the function is just to prevent the blood clotting, and then even it will be giving immediate action or response for the allergic reaction in our body. So that is the function of the basophil. And the next is mast cells. Okay, so these mast cells will be served as a first line of the defense against the antigen. So we have been seeing first line defense, the barriers we have been seeing. Okay, we have been seeing in the picture. Skin, serrated cells, lysosomes, these all things we have been seeing. But this mast cells, I said, will be serve as a first line defensor because this mast cells will be present in the skin and then mucosa. Okay, that's why only it will be defense the antigen which is entering into our body. So that is the function of this mast cell. And the next is monocyte. So monocyte here, what that means, it have capable to destroy the invaders. So, okay, invaders means, for example, like we said, right, fungi, bacteria, virus, like that. And then even it also have a facility just for healing and then for repairing also. And these monocytes will be produced from the bone marrow and then it will be released into the peripheral blood. So this is about the monocytes. And even this monocyte you can see friends, it is a developed dendritic cell and then macrophage. So this dendritic cell what will do means this dendritic cell, okay, is one of the material, okay, so it will be present on the cell surface of the T cells, and then even this dendritic cell will be act as a messenger between the innate and then adaptive immune system. Between this immune system, this dendritic cell will be act as a messengers. So next is about the macrophage. So macrophage here what will do means it will work as innate immune cells, and then even it what will do means it will sterilize the foreign body substance, sterilization, and then even it will be doing a phagocytosis. Okay, it engulfs the bacteria digestion here. Okay, so these are some of the cells of the immune systems. So till here is it clear, students? Anyone have any doubts in this?
Ma'am,
Yes?
ma'am, I have a doubt, ma'am.
Yeah, please ask me.
Ma'am, while staining, what type of, which color will be reflected in eosinophil and neutrophil, ma'am?
Repeat it once.
Ma'am, while staining process,
Yes.
how can we differentiate neutrophil, eosinophil, ma'am?
Through the granules.
Okay,
Okay, press of the granule size, we can differ it.
okay, ma'am.
Okay, in one more session, I'll be inform you that. Okay, I'll be explaining that.
Okay.
Okay. So next, students, we are going to discuss about the disorder. Okay, just some of the disorders only we have been given here. Okay, these are the disorders which is related to the immune system. So first is hyper IgM syndrome. Okay, it is one of the immunoglobulin deficiency. Okay, so it is characterized by the normal or elevated serum levels. Okay, and then even this hyper IgM syndrome, it is caused due to the variation in the CD40LG gene. Okay, is one of the gene CD40LG gene. Okay, and then even the range. Okay, so normal range of the IgM should be there in our body. There is an adult one that is 0.4 to 2.5 G per liter. Okay, so this much normal range should be there. If it is increased, means this disorder will be called as a hyper IgM syndrome. Okay, so to treat this, what they'll do means they'll be doing allogenic hematopoietic cell transplantation, and then even they'll be use the immunosuppressant, and then antimicrobial therapy will be done to treat this disorder syndrome. Okay, and the next is thymic hypoplasia. So thymic hypoplasia, students, it is a condition where this thymus is underdeveloped or evoluted. And the next is Biscott-Aldrich syndrome. So it's one of the rare syndromes. So there's a X-linked recessive disease. And then even this disorder, the syndrome is characterized by eczema, thrombocytopenia. There is a low platelet counts, and then even immune deficiency, and then even we can say blood in diarrhea. Okay, and the next is autoimmune thrombocytopenia. Okay, so here what will happen is in this condition, the immune system, okay, if the immune system mistakenly attack the platelets, okay, due to that platelet count will decrease, so on the time we call this autoimmune thrombocytopenia. Okay, so for this students, I mean symptoms, what are the signs and symptoms we can see means in the patient there is a bleeding, pinpoint sized reddish color, and then even purple spots we can see on the lower legs. Okay, so to treat this, what will do? They'll be giving medication, I mean medicine that is steroids will be given. And then myasthenia gravis. Okay, this is a condition students where because the abnormal weakness of muscles. And then even what are the symptoms we can see? There's a weakness in of the arm and the leg muscles. And difficulties with the, we can see the patients are suffering in difficulty with the speech and then even in chewing also. And for this treatment, students, what they do means they'll be giving a muscle strengthener and then even steroids will be given to reduce myasthenia gravis. Okay, and the next is Reiter syndrome. Okay, so Reiter syndrome, students, it is caused by an infection. Okay, so due to the bacteria. Okay, what type of bacteria means? For example, there is a chlamydia, trachomatis, or salmonella. Okay, so due to that, this type of syndrome can be caused. So what are the symptoms we can see means we can observe the patient means they'll be getting eye inflammation, then they'll be getting urinary problems, and then even their toes will be swollen, and then skin problems can be occur. Okay, so for this, what we'll do means we'll be giving medications. So we'll be giving
Ma'am,
medications like non-steroidal and then anti-inflammatory drugs. Okay, and the next is
ma'am,
Hashimoto. Yes.
I have a doubt, ma'am.
Yeah,
This
please ask me. Yeah.
Viscott-Aldrich syndrome. Viscott-Aldrich syndrome. Can you just explain again, ma'am?
Okay, I have to explain.
This
Yeah. Okay.
the third one, ma'am. Viscott-Aldrich syndrome.
Which one are you asking? Viscott-Aldrich syndrome, right?
Yes, ma'am.
Okay, I mean below the thymic hypoplasia. Okay. So this Viscott-Aldrich syndrome, it is one of the rare X-linked recessive disease. Okay, and then even due to the Viscott-Aldrich syndrome, the patients can be characterized by the like we can see eczema, thrombocytopenia, and then even we can see deficiency in their body, and then even there be a blood. Okay, during diarrhea. Okay, so these are the things we can be observed in this Viscott-Aldrich syndrome. Is it
Ma'am,
clear?
this autoimmune thrombocytopenia. Yes, ma'am.
Yeah,
This autoimmune
thrombocytopenia means here
thrombocytopenia.
what will happen means our own immune system will be attacked our own platelets in our body. Okay, mistakenly it will be
Uh,
attacks our platelets. So
okay,
due
ma'am.
to that it will
Ma'am, is it
increase
induced by? Does it happen during a trigger or does it naturally occur?
I mean for a crore in one people natural will be occur.
Okay,
Not
ma'am.
crore in millions in one people will naturally be occur. Thrombocytopenia.
Okay, okay, ma'am.
Okay, but till now the doctors are not identified why it is attacking the platelets.
Hmm.
Okay,
Okay, ma'am.
yeah. So next we'll be seeing about the Hashimoto thyroiditis. Okay, this Hashimoto thyroiditis students, here what will happen is our immune system will be creates the antibodies, and then even that antibodies will be damage our thyroid gland itself. Okay, that condition will be called as the Hashimoto thyroiditis. Okay, in this, what are the symptoms we can see? Mean there is a fatigue, hair loss, dryness, and constipation. Okay, so these are the symptoms we can be observed. And then treatment for this, they'll be giving hormone itself. Okay, these are the diagnostic test students that is will be taking here. That is a routine examination, there is urine examination, hematological examination, biochemical test, and then VDIL. There you go. Okay, so these are the tests will be taken for diagnosing these disorders. So next we are going to see about the students. You can see right there, right? You can see the screen, right? Okay. So students, now we are going to see about the clinical trials which is related to the immunology. Okay, so these are the trials currently going on in our India. Okay, in 2020 only they have been tested. This is going on, students. So, students, please mute yourself. Students, please mute yourself. So, first we'll be seeing about the immunomodulatory efficacy. Okay, immunomodulatory efficacy of the Nichi glucan in COVID-19 patient. Okay, they are doing this trial here. So for the students, they are finding out the corona patient who are affected with the coronavirus. And intervention, okay, there's a drug name. Okay, they are using the Nichi glucan. And then even this trial is going on in Telangana state in the region Yashoda Hospital. And the next trial here, they are doing a study, okay, they are finding out the treating the leprosy patients who are having the erythema nodosum leprosum reaction. Okay, with the drug they are giving, there is a concurrent the methotrexate and prednisolone. Okay, for this they are finding the patient who have leprosy and the new intervention name they have been given here. There is a methotrexate. And then this trial is going on in Maharashtra and Bombay Leprosy Project and in Delhi in the Leprosy Mission Trust. Okay, so one of the trial. So next trial is going on to study the effects of a new drug. Okay, the VIB 4920. Okay, the new drug they
Wanted to
are
go
yes.
to shop? చదువుకునేది ఉందా? ఉందా
So
లేదా?
please
లేకపోతే
mute
ఇల్లు.
yourself. Yeah. Okay, so they are finding out the drug for the treatment of the Jorgen syndrome, and then even for this type of, for this trial, they are finding the patient, okay, who are affected with the musculoskeletal system and then connective tissue disorders. An intervention name is a drug name that is a VIB 4920. So where they are doing this trial, there is in Orissa in Apollo Hospital. In Karnataka, there is in Victoria Hospital. And then even in Chandra Rheumatology and the Immunology Center and the research. In Tamil Nadu, in Chennai, Meenakshi Multi-Speciality Hospital. And in Telangana, there is in Krishna Institute of Medical Science. Okay, the trial they are doing that. And the next trial, okay, the trial to find out the effect of the atorvastatin on the dilation of the forearm blood vessels. Okay, they are finding this effects in patients with the systemic sclerosis. Okay, and the new intervention name, there is a drug name, they are using atorvastatin, that is for 40 mg. Okay, they are using for 16 weeks. Okay, they are giving these drugs for the 16 weeks for patient. And then even this trial is going on in the location is in Pondicherry in Jeepmore. So next trial there is they are doing this. They are studying the effect of the stopping the medicine in systemic lupus erythematosus. Okay, patient with a well controlled disease, they are doing this here. Okay, so here they are withdrawing the steroids. Okay, that is a glucocorticoid. tapering and then withdrawal they are doing, and then even this doing the trial on the Pondicherry and Jitmar only. And the next trial they are doing the study, okay, to determine the effectiveness of the pneumococcal vaccine in the patients of systemic lupus erythematosus. Okay, so this effect of the vaccine they are doing the trials run pneumococcal vaccine. Okay, so for this the patient, okay, they should be affected with the systemic lupus erythematosus. And the intervention name, what they are giving is a pneumovax 23. So this drug they are using. And the next is location. Okay, so where they are doing is in Uttar Pradesh. Okay, that's in Sanjay Gandhi Postgraduate Institute of the Medical Science in Lucknow. They are doing this trial. And the next trial, okay, the study on the treatment of the COVID-19 patients with the drugs. Okay, so for this trial, they need a coronavirus patient. And then what is the drug they are giving me? That is, you can see here, student, there is a tocilizumab. And then current strand of the care. Okay, one side they are taking prevention caring, and then one side they are giving this drug. There is a tocilizumab. Okay, where all they're doing in this trial in Telangana in Apollo Hospital, in Tamil Nadu in Apollo Specialty Hospital is in Vanagram, in Haryana there's Artemis Hospital, in Maharashtra two hospitals are doing. There is a Fortis Hospital. Okay, so next trial is for the antihypertensive losartan. Okay, they are giving for the additional benefits for the, treating the COVID-19 infection. Otherwise. Okay, so for this trial, they are using the drug that is the losartan, and then even they are doing this trial on the place that is the Sanjay Gandhi Postgraduate Institute of the Medical Science in Lucknow, in Maharashtra. And the next trial is that is the studies is going on, like how much the Kenacort injection is safe and then effective in the patients. Okay, you have the bone joint health issues. Okay, for this patient, they are searching there is a rheumatoid arthritis, and the intervention name, the drug name is there is a Kenacort injection, and then location in Karnataka, in Chandra Rheumatology and then Immunology Center and then research. Okay, in this place, this trials is going on. So till here is it clear, students? Anyone have any doubts in this?
No, ma'am.
Okay. So students, till here today's session is over.
Ma'am,
Yes?
one small doubt, ma'am.
Yes, please ask me. Yes.
In order to join these trials as a student or as an intern, what should we do, ma'am?
Please, 1 second, tell me, pa. Please
Ma'am,
ask because point on. Yeah.
uh, in order to join these trials or work as an intern